Hey, what's up? In the previous video we already indicated that this disease is chronic, or in other words, there is no known cure for it. But this does not mean that we only have resignation left. There is much to be done to improve the quality of life and prognosis. There are three fields in which one can intervene, which are compatible with each other, which are pharmacological measures, surgical interventions, and non-pharmacological therapies. Early and timely diagnosis makes drug treatment more effective, especially when it comes to disease-modifying anti-rheumatic drugs. Not only do they improve symptoms, but they also slow down the disease and the destruction and deformation of joints. Special mention should be made of biological drugs, such as anti-TNF drugs, which are able to prevent disability. And this is my personal record. In addition to these medications, non-steroidal anti-inflammatory drugs are also used to relieve symptoms, as well as corticosteroids, which are reserved for initial periods and outbreaks of the disease. As for surgery, little can be said here, except to mention arthroscopy, synovectomy or arthroplasty, which are measures that must be carefully evaluated with the healthcare personnel involved. As far as non-pharmacological therapies are concerned, 4 areas should be highlighted: tips related to lifestyle, exercise, physical therapy, and assistive technology. Let's take a closer look at these aspects. Arthritis and the pain that accompanies it can inhibit us from participating in activities we liked, and that can drag us into a dynamic of apathy and pain. Perceptions have a great influence on this, and this is where we have to focus our efforts. We have little or no control over the appearance of the disease, over what happens to us, but we have a lot of control over the way we take it. Yes, I know this is easy to say, and not so easy to put into practice. But it is seen that many negative thoughts are exaggerated, and suppose an added burden to the disease. One thing is pain, and another is what we do with it. Do you understand? We must not allow him to mortify us excessively. So a good strategy is to look for pleasant occupations, such as walking, listening to music, or talking to friends, neighbors or family, and even contact support associations. It's also a good idea to relieve the load on the lower joints by controlling weight. Warm compresses, dry heat, or a hot shower or bath can help relieve morning stiffness and muscle pain. The cold helps decrease acute inflammation of the joints. In any case, it is advisable not to stay more than 20 minutes in a row, and let the skin recover its normal temperature between applications. If you have to carry weight, it's best to use the larger joints and muscles. For example, instead of lifting shopping bags with your fingers, it is preferable to use the palms of your hands, or even your lower arms. As far as possible, avoid standing for long periods of time, and activities that require repetitive movements, or a lot of strength, especially of the hands. And when it's time to rest, make sure that the joints remain well stretched. Vaccines involving attenuated microorganisms should be avoided if immunosuppressive treatment is used. Contact with tuberculosis should be avoided, and isoniazid prophylaxis should be used where appropriate. Conscientious dental hygiene is also advisable, as an oral infection can lead to bacterial endocarditis. It should be borne in mind that people with arthritis have a higher risk of developing cardiovascular disease, so it is advisable to align the care to serve both purposes. And this brings us to the next section. In this channel we have dealt with physical exercise extensively, so we will limit ourselves to highlighting here the aspects specifically related to this disease. Avoid activities that have repeated impacts, such as running. On the other hand, daily flexibility exercises are recommended, as they reduce joint stiffness. The strength ones also make a lot of sense, as they bring stability to the joints. And among the aerobic exercises, which are very good for the heart and weight control. Swimming, cycling, and walking are highly recommended, especially avoiding uneven terrain. In addition, there are other practices that combine the benefits of the previous groups, such as yoga, tai chi, pilates, or aquatic gymnastics. And what to do in case of an outbreak? It is advisable to reduce the intensity to a tolerable level of discomfort, because absolute rest quickly atrophy the muscles, and this affects the state of the joints. Another idea is to look for exercises that do not require exercising the painful joint. You may need to opt for isometric exercises, where you tighten your muscles while maintaining a posture, but without movement. Of course, it is a good idea to raise any doubts we may have in this regard with the physiotherapist who, remember, was one of the 4 non-pharmacological areas in which we could intervene. Now it is time to speak briefly, and finally, about the... Of course, we do not intend to replace here the advice of the orthopedist, just pointing out some technical aids that are not found in these establishments. For example, extra thick pens, or plates made of lightweight materials to ease the load on the joints of the hands. As for the feet, and in addition to the technical footwear comfortable, wide, supporting the ankle, it is possible to relieve the joints with shock-absorbing insoles. And for domestic chores, we can surely find in well-stocked orthopedics technical aids to avoid having to twist, for example, the mop, or exert a lot of force, or open containers without difficulty. Well, and that's it for today. I hope it was helpful. Thank you very much, and see you in the next video.